Okay, welcome back everyone to the deep dive. Today we're doing a really focused session, perfect if you're revising and need those high-yield facts nailed down. We're diving into your notes on parainfluenza virus, the aim. Pull out their absolute essentials, what it is, causes, risks, how it works, what looks similar, diagnosis, treatment, basically everything you need.
Exactly. We're cutting through the noise to get to the core stuff, the bits that are most valuable for recall. Think of it as the critical pathway,
Yeah.
just based on the material provided.
Perfect. Let's jump right in then. So first up, parainfluenza virus. What actually is it? What's the fundamental definition here?
Right. So at its heart, it's a respiratory virus, a really common cause of upper airway infections.
Mhm.
Things like croup, bronchiolitis, pneumonia, and the key family name to remember for revision, paramyxoviridae.
Paramyxoviridae, okay, got that. And what's it made of? How does it actually get passed around? Etiology, transmission.
Yeah, so these are RNA viruses. The notes mention four main types, 1 to 4, and spread. It's mainly respiratory droplets, coughs, sneezes. Direct contact is also pretty significant.
Okay, RNA virus, 4 types, spreads through air and touch. Makes sense for causing those respiratory issues. Now, who really needs to be careful? Who's identified as being at higher risk?
The notes highlight young children, infants especially, and anyone with a weakened immune system. Also points out crowded places, like daycare centers, as hotspots because of that close contact you see.
Right, vulnerability plus close proximity. That makes sense. Okay, this is where it gets interesting for revision, I think. How does the virus actually cause problems, the pathophysiology bit?
Well, the key thing is that these viruses infect the cells lining your respiratory tract, the epithelial cells. This infection leads to inflammation, causes swelling. And that swelling, plus more mucus being produced, can narrow or even block the airways. That inflammation plus mucus mechanism, that's really central to understanding the symptoms.
Ah, okay. So it's a physical narrowing from the swelling and the mucus. That explains a lot. So given that mechanism, what other conditions might look similar? What are the differentials mentioned?
Yeah, this is crucial, isn't it? For exams and things, clinically, it can look a lot like other common respiratory bugs. RSV, flu, adenovirus, human metapneumovirus. The notes are pretty clear. You often need lab tests to be sure which one it is.
So you can't just tell by looking, you need to test.
Right.
How common is it then? And does it pop up more at certain times of year? Epidemiology.
Oh, it's very common globally. A major cause of respiratory infections, especially in kids. And for the UK context specifically, the notes say outbreaks tend to happen more in autumn and winter.
Seasonal common hits kids. Got it. Let's talk symptoms. What would you actually see in someone? Clinical features.
Symptoms can really vary. Depends on the virus type, how severe it is. You get the usual stuff. Cough, sore throat, runny nose, fever, hoarseness, maybe trouble breathing. But the real key, especially for types 1 and 2, and definitely one for revision notes, is that distinctive barking cough you get with croup. It can also show up as bronchiolitis, particularly in very young infants. That barking cough, though that's a classic memory hook.
That barking cough.
Yeah.
Definitely underlining that one. Okay, beyond symptoms, how do the notes say we investigate?
Well, diagnosis usually starts clinically, based on the symptoms, the history, but to confirm it and tell it apart from those lookalikes, you really need lab tests. Things like rapid antigen tests or PCR, which looks for the virus's genetic material. That's very sensitive. Chest x-rays might come into play in more severe cases just to check the lungs.
Okay, clinical picture first, then confirm with labs. Makes sense. And management. How do we treat it, according to these notes?
It's mostly supportive care. That's the main thing. So, focusing on easing the symptoms. Rest, fluids, keeping hydrated. Maybe over-the-counter stuff for fever and pain. The notes do say that more severe infections, or ones with complications, might need hospital admission.
Supportive care for most, but watch out for severe cases. Okay, what's the usual outcome? Prognosis.
Generally, it's good. Most people get better without any lasting problems. But, and this is important, severe infections can lead to serious issues, especially in those vulnerable groups we mentioned.
Right, which leads us nicely to complications. What are the main ones listed?
The main ones are really severe forms of the infections it causes itself. So, severe croup, severe bronchiolitis or developing pneumonia. Otitis mediate ear infections, that's listed too. And it can make existing respiratory conditions worse. Basically, severe cases needing hospitalization for breathing problems, those are the big ones to flag.
Okay, so the infections themselves turning severe, plus ear infections and worsening other conditions.
Right.
We've covered a lot there, pretty rapidly, straight from your notes.
Yeah, we've hit the definition, etiology, risk factors. The pathophysiology differentials, epidemiology, clinical features, investigations, management, prognosis, and those potential complications. The whole spectrum from the source material.
So the key thing for you listening, for your revision, is to really connect these points now. Think about how the pathophysiology, that swelling and mucus, explains the symptoms, why it gets confused with other viruses, and which symptom is that classic flag.
Exactly. Link the family name, paramyxoviridae, the RNA virus bit, the inflammation mechanism, that barking cough for croup, and the supportive care approach. Making those connections really helps with recall.
Absolutely. And while you're consolidating all this, don't forget there are great resources out there to help you test yourself. Check out passthemsra.com and freemsra.com. They've got loads of materials and practice questions.
Definitely keep reinforcing those core facts. And maybe think about this. Given all this symptom overlap, what specific things in a real clinical situation might make you lean towards parainfluenza over the other possibilities? Something to mull over.